Good morning, everyone, and welcome to today's webinar, Everyday Living During the COVID-19 Pandemic. You can ask that. With us today is MS Nurse Advisors Jane Bridgman and Bridie Phillips. We begin all our programs with an acknowledgement. We acknowledge and pay respect to the traditional custodians past and present on whose lands we meet today. We acknowledge the deep feelings of attachment and the relationship of Aboriginal people to country, and we respect the cultural authority of the elders in each community. This slide talks about informed choice. This presentation is prepared and presented by an independent expert. The views presented are not necessarily the views of Multiple Sclerosis Limited, and we ask all individuals to seek further advice regarding the relevance of the information for their situation. I'd now like to introduce you to our presenters, Jane and Bridie. So Jane is a registered nurse with 6 years experience in disability and aged care, progressive neurological conditions and primary health care. Bridie is also a registered nurse and has committed the last 12 years to community health, predominantly in palliative care, pain management and within the MS community. Both Jane and Bridie currently work as the MS Nurse Advisors here at MSL. Just a word on the MS Nurse Advisor service. It is available for clients, carers, family members and health professionals who may have queries about multiple sclerosis, symptoms, medications and general wellbeing. If you'd like to speak to any of the nurse advisors, appointments are available by phone, Skype and FaceTime.
Hello everyone, thanks for having us today. I'm Jane and Bridie,
Hi,
would you
I'm
like to
Bridie.
introduce yourself? So
Good
we're going
morning
to start.
from my lounge room.
Yes, good morning from my house as well. We're both social distancing and working from home. So we'll start off with the questions that have been sent in. Bridie, are you ready?
Let's go for this, Jane. Let's see,
Okay.
see what we can do.
So here's the first question. Should I be going to my appointments?
Yeah, great question. So I guess it's really about essential versus non-essential. So when we're talking about non-essential appointments, so if you're talking about going to the hairdresser or getting your nails done or something like that, nah, just wait like the rest of us. We're all going to look like hairy apes by the end of this, but we're all in this together. But essential, so we're talking about medical appointments, okay? So if you're well, perhaps cancel your routine and non-urgent appointments and reschedule them, and let's just sort of see what happens down the track. But for urgent appointments, a lot of the doctors are now doing telehealth. So what I propose you do is you call ahead and you see what the clinic's proposed. So some clinics are making you wait in the car park. They're limiting people in rooms. You need to check what their disinfection process is. But basically, at the end of the day, your medical health providers are trying to protect themselves and patients from illness, and they'll do whatever they need to do to keep you safe if you are needed to be seen.
Okay, thanks, Bridie. Do you have a question for me?
I certainly do, Jane. And the question that I've picked out here for you, can I still go to the pharmacy to pick up my medicines?
We need you to continue medication as prescribed. So the short answer is, if you need to, yes. You can get a friend or family member to go instead if you have that available to you. There might be options for home delivery. Often pharmacies will do deliveries anyway because they may already be set up to deliver to some local nursing homes, for example. And especially if they know you and you live locally, that might be easy. And also you could ask about, with regular medications, whether you can get more than one refill at once. So quite often you would have a repeat prescription. So ask if you can get 2 months worth at one time, just to minimise how often you have to go.
Could you perhaps get some of the medications put into Webster packs, do you think, Jane? Would some of the pharmacies deliver?
Yeah, absolutely. So I think that's another consideration as well. And it could just be as simple as calling ahead to the chemist and saying, look, I'm coming in, can you have it all ready to go, and make it really simple. But if you're worried, give them a call and find out what the best way is to move forward. All right,
Excellent.
question for you, Bridie.
Cool.
What if I can't get onto my MS clinic, neurologist, MS nurse or GP? So someone's tried to get onto their team, but they haven't heard back yet.
Okay, that's a real problem at the moment. Unfortunately, resources are really stretched at present, as we know from all the media and what we've been seeing. Leave messages. They will get your messages. So if it's not urgent and you need a response, please email them, call them, leave voicemails, whatever you need to do. However, if the matter is urgent, you think you're having a relapse, you're really worried about your health in any other ways, call ahead to an emergency department and report your situation before you're going down so they're prepared for you. I wouldn't just sort of rock up at the moment, given the state of the nation and how things are. Or if it's extremely urgent, I'd actually call an ambulance. That way you're actually bypassing the waiting room. Jane and I are always available for advice if you need. So you can ring MS Connect and ask for either Jane or myself just to get maybe a little bit of reassurance around what you're doing. You can call the drug companies that are associated with your drug for patient support. And don't forget, you can call the locums 136 or Nurse on Call for advice in the meantime.
Okay, good. So lots of support there.
Yeah, there is. You just need to know where to go to get it.
Okay, thanks,
So,
Bridie.
Jane, I've got a question here. I see an osteopath for pain. Should I take my own towel? I'm anxious about putting my face in the hole on the bed. Good
Really good
thought.
question. Yeah, I
Yep.
also don't like putting my face on the bed because it always ruins my makeup. Um, so thinking about this, we need to consider a few things. The first interesting part of that question is the reason that you're going. If it's for pain management, that's quite important, and this might go for some time, and we don't want you to be in pain for the next couple of months. Taking your own towel is definitely going to minimize the risk, and asking the osteopath what infection control measures they are following. Usually the beds are made of like a vinyl, so they're very easy to wipe down. And the osteopath should be well trained in general infection control. So give them a call, find out what they're doing to keep people safe. If it's necessary for you to still attend, make sure you minimize contact with things you might inadvertently do, like maybe the walls or the doors. Don't sit on a chair in the waiting room, and just be really mindful about any contact. If it's possible that you don't go, or perhaps they end up closing down, ask them if they can provide you with some exercises or things, stretches to do at home. I'm sure it won't be as good as going in person, but it might be better than nothing. All right, Bridie, next question for you. Oh, this is about medication. I'm going to have my first Tysabri infusion on the 15th of April, but I'm too scared to enter a hospital. Should I cancel?
Please don't cancel your infusion. So your neurologist has assessed you as requiring you to have that disease modifying therapy based on your current situation. So we're actually not keen to see a lot of people have relapses or disease progression because they're not on their treatment. What I suggest you do is you call your neurologist and you have an authentic conversation around your concerns and options. There could be, I know some centres, they're offering infusions at home or closer to home, but not all clinics have the options for variants. So if you are, and so please have that discussion with your neurologist about, what you potentially could do. But if you are required to attend an infusion centre, all the clients there are screened. All of them are immune compromised, including, because a lot of the centres often are used for chemotherapy and things as well. So all of those patients are also compromised. So you're really at little risk to each other. So, and the other thing about that is that the disinfection process in those units are thorough. They're really thorough, and I know a lot of the hospitals are putting in extra precautions at the moment. So yeah, please don't cancel until you've had that medical advice from your particular neurologist.
Good answer, Bridie.
Now, my friend Jane, I've got one here for you.
Okay.
Okay. This is a good one actually, and this has come up a lot. Should I be working from home, Jane?
If you can. any time that we stay home, we reduce the risk of catching COVID and also transmitting to others. So we kind of have two roles at the moment. The main one is keeping ourselves safe, but also slowing the transmission in the community. We're often talking about what's called flattening the curve, and we know that this virus will spread, but we're hoping that it will spread slowly so that the health system can keep up. So if you're able to work from home, it would be likely safer. There are lots of challenges in working from home and not everybody can. So have a chat with your GP about your particular situation, because everyone's health status is different. So for some people, it might be a bit more important than others. Another question, I suppose, about employment, Bridie, if you're ready. Here we have one. I still have to go to work, but I'm worried about being around people. What should I do?
Yeah, really, really tricky situation. So my advice on that is to follow strict community health precautions as preached to us by our local governments. And obviously different areas have slightly different rules, but please listen to what your local government has been telling you. If you've disclosed your disease, get a letter from your GP or your neurologist and ask to work from home, or see if there's some other duties that you could perhaps do in the office that's away from the main body of people. So you might be able to do some paperwork or something else rather than being frontline with customers. And of course, if you're unwell, do not attend work. I can't tell you what to do, but if you're in a high risk position and you are concerned, you really need to discuss that with your neurologist. You know, look, talking about your individual circumstances and get their expert advice for you.
Thanks, Bridie.
No worries. I hope that answered that. It's a really, really hard one at the moment. Jane, yeah. Okay, now this is a little bit about house. I'm concerned other people in my house who are still working might be putting me at risk. What are your thoughts on that?
Okay, well, I'll answer that question in a second. I'm just going to let you know that we are hearing some people might be having difficulty in hearing us. I'm really sorry about that. I think there might be some difficulties due to the burden on the online systems that we're having, but this webinar will be recorded and available on the website. So if you're having trouble hearing,
good. Thanks,
just
Jane.
apologising for that, but we will be recording this. So just remind me again, Bridie, your question was about
having
which
people
was your
in the
question?
house who are working and putting
Yes,
the person with MS at extra risk, and you know what your thoughts are about that.
absolutely. So if there are other people in your house that are working, it does, I suppose, increase the risk a little bit if they are going out into the community, depending on their job. It's a lot different if someone is, say, working in a quite isolated role versus working in a supermarket, for example, and having a discussion with your GP about your risk factors is important. We are aware, Bridie, I think we've discussed this before, that some of our clients have had family members actually stop working because the person with MS may be in a more vulnerable situation. So if you have someone in your household that is working in quite a high risk job, and I say high risk meaning that they might come in contact with lots of different people, that may be something that we need to be more mindful of, and also being extra cautious about all of those hygiene practices. So question for you, Bridie. How safe is it to have helpers come into my home, such as like house cleaners, gardeners, or tradespeople? And should I reduce the number of visits?
Okay, yeah, and I have had this question a few times. Again, it depends on essential versus non-essential services. So first of all, think about calling the service provider and check their infection control protocols. That's the first thing I would do. And then have a think about some of these things. Can you reduce the number of visits a service provides and still be okay? So, for example, showers. If you're having 3 a week, can you break that down to 2 a week? So thinking about that. But if the people coming in are your way of getting up each day, and a part of your everyday quality of life, then keep them coming. But see if you can ask for continuity of carers to limit the number of different people attending your home. And then that way you haven't got as many different people sort of coming in. And then the other things to think about, you know, with tradies, do you really need that tiling finished at present? Is the room functionable and safe for a few months until we see where this virus is going? Can you ask your gardener to do extra chores outside for you, like put the rubbish bins out? Don't go outside and talk with them face to face. And with gardening, a nice garden is spirit lifting. So keep them coming if you can. So really what it boils down to is what's necessary, what's not necessary, what you can go without, limit the amount of people, and make sure that they're carrying out really good infection control.
Okay, thank you.
All right, my friend Jane, I've got one for you. All right. Can I still have things delivered to the home? Do I need to wipe down the groceries or the takeaway food containers?
Yeah, so definitely still have things delivered if you need them. We do need to be mindful that we need things during this time. So in that situation, a lot of companies are doing no contact or no touch deliveries. So most things will be kind of delivered at the front door. Maybe they'll ring the doorbell and they'll leave. So that's a really good system. If things do come in packages or boxes, be mindful that the outside of those boxes could be contaminated. If it's possible, open the box or the package on the front step or the front porch and actually bring in the individual item, and be mindful that in the best situation, you might wipe things down, even your groceries as well. And any cardboard in theory or packaging could hold the virus. So we just want to be mindful about keeping that clean and washing that. And also, if you do see a delivery person outside the window, give them a wave and say thank you, because they are providing an essential service during this time. And we're ever so grateful to be able to continue having those things delivered.
Yeah, that's great. So we can still have our takeaway food and enjoy it. Gotta have some luxuries, don't we?
Absolutely. So a
All right.
question for you. I live with somebody who has MS. Is there anything I can do to support them during this time?
Yeah. Yeah, this is very close to heart. So really be considerate and understanding of their fear at present. Provide emotional support as best as you can and trying to have some fun as we all are. You know, make the most of the situation, learn about each other, love each other, and just do all the things that, you know, you would normally do in a family, but practically protect them. You do the
Mm.
shopping, you do the petrol fill-ups, the pharmacy runs, and keep them away from the public as much as possible. And of course, when you're out and about, you need to carry out strict community health precautions.
And I
If
think
that,
it's also really good to be mindful of how much hype that we're talking about in the house, or having the news on all day or the radio on all day if it's continual news
mm,
coverage of coronavirus, because for some
yeah.
people, extra information makes us feel safe. And then for other people, that continual news cycle and extra information can make us feel more worried. So I think that's probably another good thing to be mindful of.
Yeah, and I guess, Jane, this kind of flows on to the question, you know, should I be going to the supermarket? So,
Mm,
yeah, avoid it if you can. So, if you're the one with MS, avoid it if you can. Get someone else to do the shopping and the chemist runs. If you can, consider online shopping. So, you are
mm.
eligible. People who are immunosuppressed, disabled, elderly, you can do Woolies online. Go ahead and register. It's a really great service at the moment. They deliver the groceries to the door. But if you do need to go, ensure you have a list prepared so you're in and out, and ensure you carry out strict precautions. Hand sanitize before you get back into the car. Wash your hands when you get back in. Wipe everything down as you've previously discussed. The other thing is to consider smaller shopping centres. See if your local businesses will deliver. There's no harm in actually calling them. As we know, a lot of businesses are trying to stay afloat. So why not call them and see if they're willing to do some delivery?
And I think we also just found out late afternoon yesterday or this morning that the NDIS should be sending out unique codes to participants so that they can access Woolworths online shopping. I'm not exactly sure how that's working out. So keep an eye out for the continual ways that we're being supported. I know that everyone's not on the NDIS, but there's lots of other options as well. So get in contact with us if you're having difficulty getting your groceries.
Okay. Oh, I think it's time for you to do one, Jane. Okay. This one's a little bit about medication, and I'll jump to this one. So I had my Ocrevus infusion on the 12th of March. Do you recommend having the flu vaccine?
It is recommended that all people with MS and related conditions have the flu vaccine when it becomes available. And the same goes with the pneumococcal vaccine as well. So that's a good thing to chat to the doctor about. I've got a question here, Bridie, about medication, which is probably a good follow-on. Someone has sent in, just wondering, if you take Gilenya and your white blood cell level is 1.5, is your immune system compromised, and what can you do? And then we've had a similar question. Are people with MS on certain treatments more at risk if they contact COVID-19? If so, should they be more prudent about isolation?
Yeah, look, this is a very specific question, and it's about one potential treatment. So in response to the many questions that Jane and I have had and that have come through to MS, around immune suppression, disease modifying therapies and COVID-19, we now have a brilliant webinar on our website by Dr. Annika van der Walt. She's a leading specialist here in Melbourne, and the webinar seriously covers all you need to know about this sort of topic. So please do yourselves a favour and actually look at it. And also, you know, if there's some specific information that you want that comes out of that, please feel free to call Jane or I, and we can sort of talk a little bit offline further on that. But what we can tell you is that some MS medications might actually increase your risk of developing complications from COVID-19, and you need to discuss your individual circumstances with your neurologist. So in relation to Gilenya, we're told by MS Australia it's considered mildly immunosuppressive, and there's no current evidence that there's increased risk of you developing COVID-19. The basic message is you need to be vigilant with social distancing and hand hygiene. Look, there's statistics coming out of other countries around MS and things like that, but that's a whole another topic, and you know, Jane or I would be happy to maybe share some of those offline.
Thanks, Bridie. Have you got a question ready for me?
Oh, I think I probably have. Steroids come up a little bit in conversation, and this is a good question from someone. I've previously had steroids to treat a relapse. If I have a relapse during this time, is it safe to have steroids now?
So there's probably two main points to this question, or the answer, I suppose. The first one is that steroids are not always required or recommended for a relapse. And in terms of if someone is unwell, steroids are not recommended if you have a viral infection, as they can actually suppress the immune system, which really reduces your ability to resist or fight an infection. And if you do have a relapse during this time, I certainly hope that you are contacting your team, and they will discuss with you whether or not they think it's appropriate for you to have steroids. And they can be given intravenously, which is quite often in hospital, but sometimes done via hospital in the home, or it may be that oral steroids are considered instead if they are needed. All right, a question for you, Bridie. How can I support my health whilst I'm staying at home?
Okay, so let's look at this as in general terms. So I know we've had lots of questions around foods, immune boosting supplements, walking, general health. So the biggest message I can give all of you is you need to look after your mental and physical health. So you need to eat well. So that means limiting comfort food and alcohol. That doesn't mean not having any, because we all know, that's a part of our enjoyment. But it's important to try and stick to a regular routine. And that's important for establishing good sleep patterns, bowel and bladder health. If you sort of think about, you get out of routine, so do all of those things. Going for a walk. It's okay as long as you practice social distancing. It's actually good for clearing the mind and maintaining a healthy cardiovascular system. Talk to your GP if you're struggling with sleep, because we all know sleep deprivation takes its toll on our mental and physical health. Supplements are okay if they make you feel better, and they're okay for you to take, but always check with your pharmacist before you add these to your daily intake in case there's some unwanted interactions, with your prescribed medications that you're on. And lastly, talk to someone if your mood is low. Open up. Really important, which probably leads on to what I'd like to ask you, Jane. Being isolated like this, how can I deal with the stress and the worry, and who can I call if I'm feeling really worried and distressed?
Well, I suppose the first thing I want you to know is that it's normal to feel stress or sad or anxious during a crisis, and you're not alone. And it's okay if you're feeling upset about something that might seem not a big deal. There are people that have had to, cancel weddings and things like that, and that might seem quite trivial, but it's devastating. But also, really major things are happening. You may have had people in the family unwell, might have lost your job. I think we've talked, Bridie, about not being able to follow on with spiritual commitments like going to church, or for many of us, Easter is a time where we have family traditions, whether it's going away
Yeah.
or something else. So you're not alone, and there is help available. If you have friends or family or a confidant that you feel comfortable in speaking with, have a chat with them. Sometimes it helps to talk about our worries, and sometimes it helps just to talk about something else and kind of switch our focus for a moment. See what you can do to engage in social activities where you can connect with other people, or consider joining peer support. We have a wonderful peer support program that you can access via calling us at MS. But if you're needing a bit more support, certainly call your GP and let them know how you're feeling. Let them know that you are struggling a little bit, to reach out for some help. They may be able to do a referral for you under a mental health care plan, and that actually gives you subsidised consultations with a psychologist. And at the moment, I believe they are able to Medicare bill phone consultations, at least a portion of the cost, so that can help as well. And it's also really important to know that services like Lifeline and Beyond Blue are there for you and for all of us. And if you need them, you can call them 24 hours a day. They are lovely, and they will be there for you. And we have their contact details at the end of the presentation. So get them and write them down, so that if you do have a moment and you think, God, I'm really not coping, then you can give them a call. And I suppose
Perfect,
that kind of
Jane.
it links into the next question I have for you, which is, how do I keep connected whilst I'm staying at home?
So we're so lucky these days to have social media. So there's lots of apps that you can get onto at the moment and do a lot of group stuff. So, if you have access to a computer or to your phone, FaceTime, Skype, Zoom, WhatsApp, Facebook, all of those things. I can tell you that I do my choirs that I am so passionate about via Zoom. It's amazing to still have that connection. Instagram's another one. But for those that don't have access to this, good old phone calls and letters you know, you still got connection. My 6-year-old grandson's been exchanging letters with his school friends. How exciting, you know, learning about letters, but getting that letter in the mailbox and having that read. So don't forget that. Now, don't forget MS has phone peer support as well. So if you're not hooked into one of those groups, call MS Connect and seriously consider that. I know we also have Facebook pages and all sorts of things. So if you are feeling like you have no one to speak to, please contact MS Connect and see whether we can hook you in with someone. So, you know, and especially at this time where you're feeling really vulnerable, that connection with someone who's feeling the same is invaluable.
Thanks, Bridie. And I think you might have another question for me. Is that right?
Yeah, I do. All right. Now, this is actually a really good question. So, how do you look after yourself, especially when you've recently had pneumonia, so you're more vulnerable, or a number of other health conditions? Do you need to be more
Mm.
careful?
Absolutely. If you are recovering from pneumonia, it's important to know that you are recovering. You're still in the process of getting back up to your
Mm,
normal level of health. And pneumonia is a respiratory condition, and the way that coronavirus affects people is also through a respiratory um, infection or condition. So we really want to support our body to recover as well as possible. So be
mm,
extra vigilant with those, what we call the standard precautions, which is what you're
mm,
seeing everywhere about the social distancing and the hand washing, etc. Be really mindful of healthy lifestyle choices and self-care. So do all of the things that we're talking about, but do them from a place of looking after yourself, not of I have to do this and it's a scary thing. And self-care also involves things that make you happy. Don't just do the bare minimum at the moment. Often we forget about things that make
mm,
us laugh or make us feel good. But if you are more vulnerable or do have a number of health conditions, do contact your doctor and ask them if they want you to follow any extra
mm,
precautions. So there's all the normal things everyone else is being asked to follow. Ask them if they want you to be extra careful and what that
mm.
means so that you know you're doing the best to kind of prevent things getting any worse.
And I guess, Jane, that kind of follows on. So, you know, we're all hearing about washing hands and hand sanitizers and soap. So, what's the difference? Which is, you know, we've been asked, what's the difference between soap and sanitizer, and how exactly should I be washing my hands? How often should I do that? What's your thoughts, and what do you know about this?
Okay, so I suppose we'll start with the difference in soap and hand sanitizer. Soap doesn't necessarily kill the germs on our hands, it just removes them. So germs stick to the normal kind of oil and grease that's on our hands, which sounds kind of yucky, but it is normal. And the process of working up a lather with the soap actually works because that friction from us pushing our hands together is what lifts the oil and dirt from our hands, from our
Mm,
skin. Whereas with hand sanitizer, it's the alcohol in the sanitizer that works by killing the germs. And most people don't use enough when it comes to hand sanitizer. I can't really do a good demo of hand washing, but we'll do a demo of the hand technique, I suppose, because um, if you've
mm.
either got hand sanitizer on your hands or soap, you need to be following quite a strict technique, which is something that we're taught in nursing school. Is that right, Bridie?
Yeah, absolutely.
Yeah.
One of the very first
My first,
things, and making beds.
that's right. Yes, my first
Yeah,
certificate in my uni degree was being certified in hand washing,
yep.
which is very handy at the moment. So the first thing is to be mindful of sleeves and any jewellery that you have on. So in theory, you would take off a watch or anything that could be keeping germs underneath it, and you would want to pull up your sleeves so that you can kind of wash far enough down. And then with hand sanitizer, each little container should kind of tell you how much you need, but most people don't use enough. It needs to be wet for about 20 seconds. So you want to put on a good amount And now this is the technique that we should follow. And it's probably the same if you're washing with soap. So the first thing you want to do is rub your palms, there we go, together. So that you've distributed it, and it might run down your wrists, and that's okay. We then want to work into the webbing of the fingers, so using interlocking fingers like this, and then on the other hand as well, like this, so that we're getting between the fingers. Then we want to work on the tops of the fingers and the palms of the hands, so interlocking the hands and rubbing them together as well, because all around the nails can get a little bit dirty, so we want to get in there as well. We also want to not forget the thumbs, so going around the base of the thumb and giving that a good rub as well, and then focusing on the backs of the hands. And my hands are still wet, as you'll note. So my hand sanitizer hasn't actually dried yet. You should keep moving the product around until it does dry. And it's very important not to wipe it off. So my hands are still a little bit damp. It would be tempting just to wipe it on my clothes, but that would actually ruin the effect of how this works. So it's just evaporating now. You can see my hands are slightly damp, and that is actually how that hand sanitizer works. So I shouldn't touch anything until my hands are dry, and when they're dry, in effect, they are clean. Now, if you're washing your hands at home, then you should be, or in public, you should be drying them. Now, disposable hand towel is preferable because we know that it's clean and you throw it out. If you are using a reusable towel, such as at home, you've got a hand towel, consider whether you can have a different towel for each person in the family, just to make sure, because if you haven't washed your hands well, they're still dirty, and then you take them to that towel and dry your hands, you've just put the germ on the towel. So if someone else comes along, cleans their hands really well, and then goes to that towel, they've just put those germs on. So my hands are now dry actually, and they are clean. And in terms of when to do that, all the time. You basically can't wash them too much. So the standard hygiene outside of infection control for COVID would be before and after we eat, before and after you're going to the bathroom or preparing food, those kinds of things. In this situation, every time you go out of your home and you touch something, you should consider that your hands need cleaning in effect. It's okay if you're at the supermarket and you are touching things, but then be mindful, did you pick up your phone and then put that back in your pocket and then get home, wash your hands, but your phone's still dirty? So think about that. And we are kind of routinely every now and then giving our car keys a wipe down or giving the phone a wipe down as well to keep an eye on that. So being really mindful about just doing it as much as possible. And if you are coming in contact with anyone, to wash your hands, but also be mindful that if your hands aren't clean, don't touch your face. We quite often do this, and me especially. You're at the supermarket, you pick something up, you put it down, you scratch your nose, you touch your eye, and all of a sudden you've got that germ and just put it straight inside your body. So be careful about that.
So Jane, if I'm using a spray sanitizer, I do the same thing, just make sure I put plenty of spray on my hands and do the same technique, don't I?
That's right.
Is that right?
That's right. And you'll soon notice that your hands become very dry. As nurses, we can attest to that because we have to use hand sanitizer before and after every task and every patient. But a good moisturizer will make a big difference. And if you find that your hands are getting dry, it's really important to care for them, because if the skin on your hands becomes cracked or irritated, that's going to increase the risk of you catching germs.
Absolutely. Great job, Jane. Good demo.
Thank you. And I've got another question here for you, Bridie, my last question. I'm getting confused with different information. Gosh, aren't we all? What should I follow? And I think this really plays into the fact that different countries around the world are doing different things, different states are doing different things. And then some of our clients are saying, well, hey, I know someone with MS and their doctors told them to do something different. So what should they follow? What should they follow?
All right, you must follow the rules that are proposed by the government in each state. It's law, and it's for your own protection and for the safety of the wider community. So go by that. However, Your neurologist might propose some different rules for you based on your individual situation. Have a direct conversation with that neurologist and ask for their reason behind this so you can make an informed decision about your own behaviours. Please, our country is very different to other countries at the moment, so please look for updates on the MS Australia webpage as to what's actually happening, and you know, have a look at our webpage for updates and listen very carefully to what the health ministers are saying in your region. I hope that answered that. And look, I can't stress enough on behalf of Jane and myself how important it is to look after yourselves at the moment. We're all in this together. We're passionate about supporting you through this unsettling time. We're here for private discussions. If anything has come up in this webinar or you felt that your question hasn't been answered, we're learning about COVID-19 as you guys are. We know about MS, we know about the drugs, we know all about this, and we are picking up from our sources, our neurologists and you know, the WHO, everyone, about how best to manage you all with COVID-19. So please take care, everyone. Our thoughts are with you all. And now I'm going to hand over back to Annie, who's going to complete this webinar. And it's been an absolute pleasure on behalf of Jane and myself to be with you this morning.
Stay well, everyone, and like Bridie said, reach out if there's anything we can do. We're definitely still operating as normal. Many of our services are still remaining unchanged, so do give us a call or contact us through MS Connect, because our services are still running as normal. Is that right, Bridie?
Yeah, absolutely. MS Connect number, there'll be a lot of information after this that you'll be able to grab some numbers and links. Take care, everyone.
All right, we'll turn off our
Thanks,
webcams
Jane.
and hand up to Annie. Bye, Bridie.
Bye.
Thank you very much, Jane and Bridie. That was very informative information. I have had word that a few of us were experiencing some audio issues, so I do apologise. But just letting you know that the webinar is recorded, although the broadcast had some audio issues. Hopefully the recording will be fine, and we'll have that up on our website as soon as possible. Also letting you know that due to the audio issues, there were a few more questions that have come through. We won't be able to respond to those at this point. However, we will contact you individually and answer your questions for you. I'm hoping you can all see my screen. On the screen are the list of resources. So just letting you know, the coronavirus hotline is 1800 675 398. And if you suspect you have coronavirus, please contact this number. It's available 24 hours a day, 7 days a week, which is fantastic. Please keep 000 for emergencies only. That would be much appreciated. There is updated information and advice on the MS Australia website. That link is available there on the screen. Also, you can get specific information regarding the various states. Listed on the screen are the state websites for the state governments in your area. So please access those for further information as well. If you need further support, Lifeline is available 24 hours a day, 7 days a week on 13 11 14. And Beyond Blue is also available on 1300 22 46 36. There was a conversation about COVID-19 with neurologist Associate Professor Annika van der Walt. You can access that through the YouTube channel to watch that talk, or you can access it through our website. Just letting you know that MS Connect remains available to you. Our services are still available either online or by phone, and this is to ensure that the safety of our staff, our clients and our participants. So please, if you do have any questions that you want support with, if you have questions about the peer support program, the employment support services or any allied health support, or NDIS support or access to the aged care, the My Aged Care website, please contact MS Connect. That number is a free call, 1800 042 138, or please send through an email to msconnect@ms.org.au. So thank you once again for joining us today, and a big thank you to Jane and Bridie for the information that you provided for us today. As I mentioned, any further questions that have come through, we will respond to you individually. And if you'd like to give us a call on MS Connect, the number is there on your screen, as well as the email address. And despite all the audio issues, I hope that you found the information useful and of benefit to you. We would invite you to stay online and complete a short survey as soon as this webinar finishes. That would be very much appreciated. Wishing you well, stay safe, and we hope to see you online again soon. Thanks everyone, bye for now.